And welcome back to the Kiosk Presents. Joining me today is Dr. David Henry, Clinical Professor of Medicine, and Tom Kirk, President and CEO of the Prostate Cancer Network. Thank you so much for joining us today here on the Kiosk Presents.
You're welcome. Good morning.
Yeah, it's a pleasure to be here.
Well, we're talking about a somewhat serious topic today, the spread of cancer to the bone and bone health in general. What can you tell us about how cancer spreads to the bone?
So it's a very interesting, somewhat not aware problem that occurs in people and patients. Most cancers, the common cancers, breast, colon, lung, prostate, don't spread to bone, don't spread anywhere because of early detection and screening, so that's good. But some do. Prostate cancer, when it spreads, may be as much as 90% in the bone, the first place. Breast cancer, 2/3 may go to bone, the first place it may spread. So our idea today is to increase awareness about this issue. So patients who have carried these diagnoses should be aware and discuss symptoms. Fully half of patients with spread to bone may not have bone pain. So visits to doctor's office, blood work, scans will pick this up. And then complications like a broken bone, which could be very painful and occur with minimal trauma, like opening the door to your car, could then be prevented by the current therapeutic options.
Okay. Now, what is the actual symptoms that people will experience if they have a form of cancer that does spread to the bone?
So we say, many times we'll say what we call the 2-week rule. If your visit to the doctor is 3 months from now, but you get a cold or a flu and feel achy for 3 days, okay, that may be normal. But if something comes and stays days, a week or two, and your appointment isn't for 3 months, a new lump, a new pain, you don't feel well, you're more short of breath going upstairs, any of these different symptoms that come and stay, then we should be made aware of that before the visit or an extra visit made to your doctor.
Okay, that makes sense. So never give something more than 2 weeks to build up or cause trouble.
It's a good general rule, yes.
Okay. Now, what new resources are available for those who have cancer?
Well, we have a new website available, bonehealthinfocus.com is available, and it has video diaries of people telling their story about their particular cancer, whether it's prostate or breast or lung. So we want to make sure that you see that you're not alone, that other people have learned experiences from battling their cancer. On this site, we also have tips and questions you can ask your doctor, because it's a conversation that you need to be prepared for and have those in your family and those who care about you and your friends involved also. And remember, this is a conversation that you need to be aggressive about. You're worth it. You need to make sure that you take part in your care and not just lay back and let somebody do things to you. Modern medicine is really about a conversation between you and your doctor, and finding the right healthcare team is important. And members in your family are affected by your disease as well, and they have needs and questions that healthcare professionals can help with as well. Many of our organizations, like our network that we call Us2, has a website as well. us2.org is available as well for prostate-specific questions that members of your family may have. And remember, certain populations are at higher risk for other cancers, and so it's about being vigilant about your care.
Okay. Someone in good health, how would they know to even get checked for cancer of any type?
So that's a great question. So if you do not have a diagnosis of cancer, there are a couple screening tests that are done commonly. People over 50 getting colonoscopies, breast cancer screening over 50, and visiting the gynecologist for a woman to do cervical screening. But I think just a regular visit as we get older, and the population is getting older and healthy so, but to stay healthy, any new symptom report to your doctor. We often say, help us help you. So when you come to us, as Thomas mentioned, you want to become prepared. What questions do I have? Bring someone with you. You may get nervous and forget to ask your questions. Someone else will, and be a note taker when you're with your doctor. And of course, I'm sure no one's ever had the experience of the doctor speaking medical and being confusing. So make us speak English or your native language, not just medical, to you as we discuss this conversation, as Tom says.
Fantastic. So that website again was Bone Health in Focus?
Bonehealthinfocus.com, correct.
Yes.
Fantastic. All right, thank you so much, David. Thank you so much, Tom, for joining us today here on the Kiosk Presents. Hopefully everyone stays healthy around here, and if they don't, hopefully they have the resources they need to deal with it.
That's right. Reach out for help. It's there.